7, and 8, C7 and 8. So again, you just have to be able to count 1, 2, 3, 4, 5, 6, 7, 8. I was on neurology rotation, and the neurologist mentioned that to me, and I said, wow, is that it? I can remember that.
Like, why didn't they teach you that in school?
Right,
Yeah.
right. Why doesn't anybody say that?
Right.
I'm pretty sure that should be right next to the third thing you do in kindergarten. Your alphabet, your numbers, and then
Your
your
reflexes.
nerves. Yeah, you're right.
That would be a really good thing,
Yeah.
I think.
I think you should just throw some of that stuff in there just to see.
What sticks?
Yeah.
You could do your informative speech on
Oh gosh. No, I'm doing it on Ali Krieger. God help me. All my sources are gonna be
We have to do
ESPN.
an informative speech, and me and Kat were talking about if we did the grade and we just kept referencing Dr. Fenner and Dr. Wise. Two sources right there.
James might not appreciate that.
You could use the textbook
you-
writers,
Wait,
the
what?
authors of the textbook.
Yeah.
And he would never know. You can.
Yeah, that's the trick, is to do something he knows
Absolutely nothing about. That's why I'm
Right?
doing
Like
soccer
this,
because
How
he,
are
I.
you doing in Jurgen's class, by the way?
Ace.
And then no, I was worried about Jordan because she's got
She has a
this
bad
vocal issue.
voice, right? Oh.
I don't know. I don't. My next speech isn't until we skip Wednesday, and then I'm S, so I'm all the way at the end of the alphabet when I just want to get it over with. I honestly don't know what he expects though, because I can't control my voice. Like, I can control like and like low, but I don't notice when my voice changes. Like 110%.
And we talked about voice exercises.
Yeah, I don't think we should do that again.
How'd that go?
It's not well.
What did he do? Wait,
He wanted me to like sing the scale, like.
Me, like that, in high pitch.
Do it.
I can do that. It's
I get
just
my
see. Did it just do it?
Yeah.
Did it do it? See, I don't.
See, speech therapists will ask you to do exercises where you bring your vocal cords close together and you stretch them, like when you say high pitched sounds, like.
One of my teachers
And then-
thought I had nodules. I have nodes.
There's something going on. I think there's something if we
It's
just get down there and take a look.
I'll go to the doctor.
Jordan, it's okay. I did my informative speech today, and it basically was like a social experiment.
Really? He?
Because I was the only person in my class who even had an outline. So he looked at the outline and was like,
Go.
okay, let's see it.
That's how we did for my
And I
wedding
was
toast.
like-
That's what he did for the wedding toast. And then he pointed out one of the things and he was like, what does this mean? And I was like, you have to, I was like, do you just want me to go? And he was like, no, save the story till the end. And I was like, when I do it?
It was
so-
terrifying.
Yeah, I could see that.
It was
I think you should
it was
get-
also 6 minutes and 30
He
seconds.
won't let us volunteer
Oh.
anymore. He won't let us
Well,
volunteer
because I
anymore.
paused for 45 seconds. I was like,
He won't. He won't let us volunteer anymore because it's Hunter and I that always want to go first because we want to get it over with.
No, that other girl wants to, the one that's always on the phone in the corner.
Really? I thought she didn't want to
From
go.
like the Caribbean.
Really? I
All
thought
right.
she didn't want to go.
What we're
She's
gonna
never
do
ready to
is,
go.
we'll do one case study today, and we'll do the other ones next time. But let's kind of demonstrate what we've been talking about now. Case study. Sam is a 43-year-old nurse who's trying to push a car onto the shoulder of the road after it stalls at a red light. And as she's doing so, she notices the sudden severe onset of low back pain. Okay? She feels as if something snapped in the lower part of her spine. Later, she notices that the pain extends down the posterior aspect of her right thigh and leg, and she's got numbness and tingling over the lateral part of her leg, foot, and little toe. So over her leg, foot, and little toe, she's got some numbness and tingling. We'll call that paresthesias. Okay? On physical exam, she's got a dull ache in her low back, which is aggravated by straining and coughing. And as a result of the pain, she exhibits marked limitation in range of motion of the lumbar spine. In other words, typically most people, if you ask them to flex at the lumbar spine, they can flex to about 90 degrees, like this. But when she goes to flex, she suddenly stops because of pain. Okay? Now, you can test by having her flex, or what you can do is simply have her lie back and you flex her lower extremity. Okay, and then she suddenly pulls away or withdraws because of pain. So raising her extended right lower extremity is quite painful. Now, on motor testing, you're testing all the major muscle groups. When you have her perform toe walking, that means standing up on her toes and walking, she can't bear weight on that right foot. In other words, she's got right plantar weakness. Okay? Now remember, and you don't know this, but the gastrocnemius, innervated by S1, is responsible for plantar flexion, for doing this, moving up on your toes. Okay? So she's got some motor weakness involving the gastrocnemius, which is innervated by S1. Sensory testing reveals decreased perception to touch and pinprick. Okay, how do you test light touch and pinprick? With light touch, you simply take a cotton swab, have the patient close their eyes, and touch different areas of the skin, different dermatomes, to make sure she appreciates the fact that you're touching her.
Appreciates.
To assess for pinprick, what you'll do is you'll take a pin, you'll have the patient close their eyes, and then you'll either touch with the sharp side or the dull side and ask her to discriminate, sharp or dull. If she can't do so, then there's a loss of pinprick sensation. Okay? So when you do that sensory testing on her, there's a decreased perception of touch and pinprick over the dorsal side of her right, fourth, and fifth toes. Okay? So there's decreased sensation. And it says here that the Achilles reflex is hypoactive. Hypoactive. So let's look at the questions. It says, based on the map of the dermatomes provided in the handout, what nerve involvement most likely accounts for the loss of sensation and the paresthesias? So let's look here at the dermatomal map. Here it is. Okay, she has numbness and tingling over the lateral aspect of her leg and foot. And that kind of goes along with S1, doesn't it?
Mm-hmm.
Yeah.
Now, she also has a decreased sensation to touch and pinprick over the dorsal aspect of her fourth and fifth toes. That goes along with S1 also. So the distribution of the sensory loss as well as the paresthesias suggests some involvement of S1. Okay, so that would kind of answer the first question.
Yes.
Let's go back. Okay. What nerve provides innervation to the distal lower extremities and would most likely carry axons which control muscles which provide for plantar flexion? That would be the sciatic nerve. Okay? What plexus does this nerve originate from? Sacral plexus. What spinal nerves contribute to this plexus? S1 through S4. Okay? So the sciatic nerve is going to carry axons from one or more of those spinal segments, S1 through S4. Now, it's given off branches all the way down to the level of the foot. By the time it reaches the gastrocnemius, the branch that provides innervation to the gastrocnemius only carries S1. Okay? So then it asks, what's the principal muscle responsible for plantar flexion and the ankle jerk reflex? That would be the gastrocnemius. All right, so if she has some type of damage to S1, it's going to cause paresthesias or sensory deficit in the S1 dermatomal distribution. That's what we saw. If there's motor involvement, then it's going to cause muscle weakness in those muscles that are innervated by S1, in this case, the quadriceps. That's why she has difficulty bearing weight on the right foot. It says, what nerve root is needed now for the Achilles reflex? S1. If there's damage to S1, which is a lower motor neuron, then she's going to have a hypoactive reflex, because lower motor neuron deficits are associated with hypoactive reflexes. And so this physical examination is screaming lower motor neuron. It's screaming S1. Now, the combination of low back pain, radiating, she's impinging upon S1, which is carried by the sciatic nerve. She has inflammation of the S1, and with it inflammation of the sciatic nerve, which radiates down the leg. So that pain caused by impingement is going to radiate down her leg. We call this sciatica. What is going on here? Well, if you look here, this is the intervertebral disc. Here we see a segment of the intervertebral disc herniating, and as it's doing so, it's compressing this spinal nerve. So when she was straining to push a car, it triggered herniation of her disc. That in turn is compressing the spinal nerve. Now, the location of the compression depends upon where the disc herniates. Sometimes you can have a herniation that compresses the dorsal root, in which case your symptoms are solely sensory. Sometimes it compresses a ventral root, in which case you only have motor symptoms, or sometimes like this one, it's compressing the entire spinal nerve, in which you have mixed symptoms, both motor and sensory. And that's what we have here.
I'm pretty sure that my child was doing that when I was carrying her.
That she was doing what?
She was compressing my sciatic nerve. I had to walk with a crutch on my right side for a while.
Oh, wow.
She goes
How
to
long?
physical
Like,
therapy.
how long? Like when did it happen in the pregnancy?
My second trimester.
I thought you meant like now. Like I thought you were talking about like.
Now, let's just get back to business a little bit.
Sorry.
It
That's-
takes
no,
me
no,
a
I'm
minute.
glad, but I didn't want to get Jordan going.
I'm sorry.
No, we like to hear your stories.
I like to know about people's lives.
Right, and I like that. I like that about you.
Future PA student.
Now, here's the disc that's herniating. It's an L5-S1 disc. If we look at it in cross-section, there are two components to the disc. There's the nucleus pulposus, which is a gel-like material, and it's surrounded by the annulus fibrosus. What happens when you strain is that you can tear the annulus fibrosus and allows part of that gel-like material in the nucleus pulposus to herniate through, compressing either a root or the spinal nerve itself. Now, because it's compressing S1, you get all of the symptoms we discussed before. Remember that the ankle jerk is mediated by S1 to the gastrocnemius. It's not going to affect the knee jerk, the biceps, or the triceps reflexes because they involve other nerves. Remember, knee jerk is L2, 3, and 4 to the quadriceps, biceps C5 and C6 to the biceps, triceps C7 and C8, which is carried by the radial nerve to the triceps. Okay, we'll stop here. Does that make sense now?
It does. Everything like has like